Hi, I'm Karen McAllister from High Quality Home Therapy, where compassion matters, where you matter. A lot of people ask me, what exactly is an occupational therapist? What does an occupational therapist do that's maybe different than physical therapist? Good question. Occupational therapists help people participate in the things that they want and need to do in their everyday life. So these are things that make lives more meaningful, pleasant, and gratifying. Um, if you think of occupations as daily activities that we all engage in order to function, you can think of driving, eating, bathing, socializing, participating in all leisure activities, so having fun, um, attending school, functioning in the workplace, um, pretty much everything to do with eating, breathing, and living. OTs teach strategies and techniques and support people to master skills specifically so that they can function in their life to their highest potential. From vestibular, oculomotor, and cognitive training after a concussion to social and emotional development for people who might struggle in social situations, maybe making friends, maybe keeping personal distance, maybe knowing the right things to say when you're in groups, or if you have fear of being videoed, like me, to coping with mental health conditions such as anxiety and depression. You can think of an occupational therapist who's skilled in psychology, um, as maybe a cheaper psychologist. They are heavily trained in psychology throughout their schooling, and our occupational therapists happen to have master's and doctorate degrees. So, learning about nutrition, maybe meal plans, planning meal plans, learning how to go grocery shopping. So, you're buying the most healthy foods and putting together your organization of your time so that your shopping is a little more efficient. To exercise strategies. OTs can do a lot of what physical therapists do. Um, it's just depends on the particular therapist you're working with. We also at High Quality Home Therapy have occupational therapists who specialize in pelvic floor rehab. So they work with the pediatric population, the adult population, men, women, teenagers who may have some continence issues, pelvic floor pain, and may need to get a little stronger or work on strategies to help them be as independent as possible. Um, Basically, in addition, our occupational therapists use their hands and provide manual therapy. This feels like massage, but we call it therapeutic massage or soft tissue mobilization or instrument assisted soft tissue mobilization. Um, some of the occupational therapists use Pilates to help teach people core stabilization, because we need to keep our posture in order to be able to digest foods and to be able to tend to classes, even with our online and distance learning. There's a huge overlap, between occupational therapy, physical therapy, and speech therapy. And in our company, we allow that overlap and we work together with each other as clinicians to give the best possible outcomes to our patients. It doesn't really matter what letter somebody has after their name. What matters is the rapport that the patient and the clinician has, and also the will of the provider. If the provider is really motivated to help that patient achieve the goals, chances are they're going to do everything and anything and everything to help the patient. So I hope that sums up what occupational therapists do and who they are. We at High Quality Home Therapy are concerned about your health and wellness. we're offering telehealth services in addition to our in-person, in-office, and outpatient at home approach to healthcare. It's going really well, and if you have any questions, feel free to call or email me, Karen, Caryn, at hqhtherapy.com, 203-212-4191, and you can follow us on Instagram at hqhtherapy. Stay healthy.